Hello, everyone. I'm Vanessa Cartagena, Meetings and Events Associate here at America's Essential Hospitals. Thank you for joining us today, and welcome to today's webinar, part of our COVID-19 webinar series, Food Insecurity. Before we start, I want to recommend you use the dial-in number displayed on your screen to listen to today's presentation. Because COVID-19 is causing high internet usage, you might experience interruptions if you try to stream the audio portion of this webinar on your computer. So to ensure a trouble-free experience, we recommend you use the dial-in number for audio as you watch the presentation on your device. Also, like many of you, all of us here are working remotely, so please bear with us as we adjust to the challenges of producing a webinar from multiple locations. I wanted to take a moment to point out the webinar section of our website at essentialhospitals.org. You'll find upcoming and recorded webinars under the Education tab of our website. Once there, look for the webinars link in the menu just under the photo. As a member, you have full access to the rich library of recorded webinars on our site. Today's webinar is being recorded and will be available on our website by the end of the week. Today's slide deck is also available for download on our webinar page. To ensure you can interact with us today, please make sure you have selected both the participant and chat tabs on the right-hand side of your screen. Although your line is currently muted, we can open it if you have a question for our presenters during the Q&A portion of today's call. If you want to ask a question, please use the Raise Your Hand feature at the bottom of your participant panel. We will unmute your line and announce you by name. Now, I'm very pleased to introduce today's lineup of speakers. They include a member of our staff here at America's Essential Hospitals, Deborah Roseman, Principal Project Specialist. We're also excited to have our guest speaker join us today from Cook County Health, Kathy Chan, Director of Policy. Now I will turn the call over to Deborah, who will kick off our presentation today.
Thank you, Vanessa. And first of all, on behalf of America's Essential Hospitals, I want to say thank you. Thank you to each and every member of your hospital staff. Thank you for your skill, dedication, and selflessness in the face of this deadly pandemic. Next slide, please. Now, more than ever, we are here to support you, to secure funding, disseminate best practices and innovations, and facilitate member-to-member knowledge transfer. Next slide, please. You'll continue hearing from us in ways you're used to, including our newsline articles, latest from action updates on policy, and action alerts to spur legislative activity. But we've also developed new communication channels specific to COVID-19, including weekly COVID-19 updates every Friday with links to policy updates, new resources, members in the news, and upcoming webinars and calls. And this weekly webinar series on Wednesdays at 2 o'clock. Next week's webinar will focus on behavioral and mental health needs during the pandemic. And as Vanessa mentioned, you can access recordings of the prior webinar on the website. And we invite you to join our email list. Next slide, please. You can go to the link on the slides and sign up for the email list to continue the discussion amongst your peers and with AEH staff. If you've already joined the email list, feel free to chime in at any time with questions or thoughts to further the discussion. Next slide, please. And you can access additional resources on the webpage. If you go to our homepage at essentialhospitals.org and click the big red bar right in the center of the page, next slide, please, that will lead you to the resource page where you will see federal, state, nonprofit, and member policies, tools, and other resources on a number of topics, such as telehealth, testing and supplies, and more recently, recovery resources. At the bottom of the page is a quick way to access recordings of previous webinars. We'll spend the rest of our time together today on a brief update on the pandemic as it stands, and then sharing what we know about food insecurity, how it intersects with the pandemic, and how essential hospitals are working to alleviate it. Then, Kathy Chan will share the essential hospital perspective and experience from Cook County Health. Finally, we'll open it up for discussion and hopefully hear from many of you as to what you're seeing and experiencing. Next slide, please. So first, a brief update on where the pandemic stands. Next slide. As of yesterday, more than 1.5 million cases have been reported in the United States, and about 92,000 people have died. As you all are seeing in your hospitals and communities, the pandemic amplifies long-standing disparities, particularly for Black Americans and other people of color who experience disadvantages across multiple social determinants of health, and largely because of those disparities, higher rates of chronic conditions have put them at greater risk of complications and death from COVID-19. Next slide, please. And while the COVID-19 pandemic is, of course, a health crisis, it has quickly also become an economic crisis. The unemployment rate has skyrocketed, and with it, millions of people have lost their health coverage as well as their income. Closures of businesses, schools, and most other facilities have had cascading effects, including exacerbating food insecurity for families who relied on free or reduced meals for school-aged children. Some school districts have sought alternative arrangements like meal pickup to ease that gap. Next slide, please. But the focus today is on how essential hospitals are involved in efforts to alleviate food insecurity for their patients and their communities. Before we get to Cook County's experience, I want to share a bit of context. Next slide, please. So first, a brief definition. Food insecurity, as you may know, is more complex than just hunger. It's about ongoing, reliable access to food or lack thereof, and not just something to eat, but nutritious food. Next slide. Before the COVID-19 pandemic hit, 37 million Americans already struggled to afford the food they needed. Of that 37 million, about 20 million were adults, an additional 5.5 million were seniors aged 60 and over, and about 11 million were children. Next slide. The communities served by essential hospitals are among those experiencing the greatest food insecurity. 10 million of that 37 million in the prior slide of food insecure individuals live in the communities served by essential hospitals. And this is, again, pre-pandemic. Next slide, please. And a number of essential hospitals have been working for years in partnership with local organizations to address food insecurity among their patients and their broader communities. Although, of course, we'll go in depth with one such example today, you can find out more about a number of essential hospitals' existing food insecurity programs on our website dedicated to social determinants of health, essentialcommunities.org. Descriptions of the programs include, among other things, information about the cross-sector partnerships involved. The website also includes a range of tools and resources, including those specific to food insecurity programming. Next slide. The efforts in which essential hospitals are engaged to reduce food insecurity span both those serving patients as well as those inclusive of the broader community. And they take a variety of forms. Some are food banks or food pantries, some located on the campus of the hospital. There are also meal delivery programs, often in collaboration with another organization like Meals on Wheels. Some hospitals partner with an organization to host a community garden. Others offer education programs like cooking classes or nutrition education in other forms. And a number of hospitals offer screening and referral, including help to enroll in SNAP or WIC, for example, to help meet nutrition needs with existing resources. And of course, some of the projects encompass multiple of these components. One example of that is the University of Massachusetts Memorial Medical Center. Next slide, please. So this is just a couple of examples of some of the programs that you'll learn more about on the website. The Veggie Mobile is the UMass Memorial Healthcare project that I just mentioned, which encompasses both a food bank component, a community garden component, and screening and referral. In addition, the Sky Farm at Eskenazi Health has a rooftop garden, and they've partnered with Meals on Wheels to deliver food prepared in the hospital to patients at no cost. And they provide healthy cooking and nutrition classes as well. Next slide. We'll hear more about Cook County's program today. And in addition, VITA, a program at Metro Health in Cleveland, trains women in the community to provide lessons on healthy cooking. Next slide, please. So food insecurity is already an acute need in many of the communities served by essential hospitals, and collaborative efforts are underway to address it. However, as I noted earlier, the pandemic exacerbates those issues. The green bar on this slide is the 37 million figure I showed you earlier of the number of food insecure individuals in the United States. But based on an impact study from Feeding America, 17.1 million more people will need assistance in accessing healthy foods due to COVID-19. That's a 46% increase in need. And nearly 1 in 5 young children in the U.S. are not getting enough to eat during the coronavirus pandemic. In a survey conducted by the Brookings Institution in late April, 17.4% of mothers with children under the age of 12 agreed with the statement that since the pandemic started, the children in my household were not eating enough because we just couldn't afford enough food. Next slide, please. So as I mentioned, a primary problem, of course, is the rapid increase in households experiencing unemployment, loss of income, perhaps also caring for someone who's sick, and mobility is also a major issue. Many communities served by essential hospitals are food deserts where people cannot access healthy, affordable food nearby. And as social distancing measures confine people to homes, they further reduce safe transportation options, and that access is further restricted. And those widespread issues are exacerbated further by several factors. As you may recall, distribution of food items was originally a problem, with people stockpiling some items and leaving shelves empty. The cost of items has been a sporadic problem. People are maybe spending more on particular items if the generic item that they often buy is out of stock, or some products like eggs have seen a price hike. Online grocery shopping has been an option for some people during this pandemic, but it does not support SNAP or government assistance programs. So that increases the burden on households, particularly in food deserts, to utilize transportation, go to the stores, and chance exposure. However, food assistance programs such as SNAP, the Supplemental Nutrition Assistance Program, have made some changes to try to alleviate this dire situation. Additional funding has been allocated to increase program participation. Programs have been restructured so that children can have access to food, such as the school program. And some of the requirements have been relaxed, such as the requirement for in-person re-enrollment for WIC, or the timelines associated with work requirements for SNAP. Next slide, please. But essential hospitals are needing to make changes too, either mounting new efforts to help their patients or communities secure ongoing access to healthy food, or changing the way they operate their existing programs. For example, some programs that require a prescription for a doctor to obtain food packages have relaxed those requirements, enabling the prescription to apply for a longer period of time. Some food pantries are changing their layouts or lines to keep patients safe in accessing them, or they're switching to or adding a food delivery component to reduce the need to come into the facility. Some programs are allowing enrollees more food to sustain an entire household or for a longer period of time rather than just an individual for a few days, for example. But in nearly every case, the hospital works with outside partners, such as a food bank, to meet those needs, and that partner may be experiencing their own limitation or otherwise increased demand. So to make this more concrete, we'll now hear from Kathy Chan, who will share how Cook County Health is responding to the needs of its patients and community. Kathy?
Thanks, Deborah, and thank you to Vanessa and the rest of the team at America's Essential Hospitals for the invitation to share the work that we've been doing and that we continue to do through the pandemic to address food insecurity. Next slide, please. So an overview, I'm just going to provide a little bit of background about our health system and what had been in place prior to the pandemic when it comes to the interventions and programs and partnerships to address food insecurity, and talk a little bit about how we have pivoted some of that work, but most importantly continued much of that work, realizing that, to Deborah's earlier comments, that the pandemic has really exacerbated the issues that had already existed in our communities when it came to not only food insecurity, but all of the other social needs that were already prevalent but now are coming to the surface in an even greater way. Next slide, please. Next slide. So I always like to start any presentations that I do just to reflect on the mission of our health system, which has a very long-standing history of not only serving as a provider of care, but really this last part, which is the additional role that we can and should be playing when it comes to advocating for not only policies, but efforts that really address the holistic needs, so physical, mental, and also social well-being of the people of Cook County. And I think that's where the food insecurity work really fits in well for us as a health system. Next slide, please. At a glance, we are a health system that includes 2 hospitals, about a dozen community health centers throughout the county of Cook, as well as the city of Chicago. And for those of you that might not be as familiar with where we're located geographically, Cook County is the county within northeastern Illinois that includes the city of Chicago, as well as a suburban area that is essentially the sea outside of the city of Chicago. We, as a system, in addition to the hospitals and community health centers that we operate, also provide correctional health services to those detained at the Cook County Jail and Juvenile Temporary Detention Center. We run the state-certified health department for most of suburban Cook County. The city of Chicago has a separate health department that it runs. And then we also run a Medicaid managed care plan called County Care, which is currently the largest plan serving Cook County residents. Next slide, please. So I'm going to talk a little bit about the work that had been in place in the health system and throughout Cook County that we have been participating in prior to COVID, to just lay some foundation as to how we got into this work and why we're continuing to do this work even in light of all the challenges that we face. Next slide, please. This is just to illustrate, and this map is a little bit old, but unfortunately the data has not really changed very much in the last few years. But this map is really just to illustrate the need of food insecurity in the county, and the darker areas indicate a higher degree of food insecurity compared to the areas that are more lightly shaded. The H's are where we have a physical presence, either in terms of a hospital or a community health center. And so this map was created by our partners at the Greater Chicago Food Depository when we started to have discussions about ways to work together to address both the needs of the individuals that the food depository has and is continuing to serve, as well as thinking about the ways that healthcare partners, including Cook County Health, could be engaged and collaborative in their efforts. And so in Cook County, prior to the pandemic, about 1 in 7 residents experiences food insecurity. And again, this is different than hunger in that this is a persistent issue that is really driven by lack of either money or other resources that prevent somebody from having consistent access to food. Next slide, please. And I don't think I need to really spend a lot of time with this group about, just this cycle of food insecurity and chronic disease that is really a vicious cycle, but that food insecurity results in changes that might be coping strategies, such as potentially eating food that might not be as healthy for you, that can result in be a driver of chronic disease, that can result in higher healthcare costs. And of course, it's just this vicious cycle that if you don't want to try to address it, it just continues and makes it more difficult for providers to really help not only address the health needs of that patient, but just if somebody is able to get connected with a provider, these are all the food insecurity is one of those issues that you have to address if you want somebody to stay on a course to health and remain on a course to be healthy. So we always share this as, kind of a foundation as to why it is we as a safety net hospital system are getting involved in food insecurity work. Next slide, please. One of the things that we started doing right from the beginning was instituting a food insecurity screening to really understand how prevalent the issue of food insecurity is among our patients. We started this work in 2015, and I'm pleased to share that we have applied this screening to all of our community health centers and to the intake process at our community health centers, as well as to the intake health risk screening process for our county care members. So we are screening a lot of patients and a lot of health plan members, in fact, the majority of them, every month whenever they are coming in for a visit or interacting with one of our care coordinators. And these two questions are the questions that are recommended to be used as part of the healthcare vital signs screening that indicate whether somebody might be at risk of food insecurity. And so an answer to either question that is anything other than never true identifies the risk of food insecurity. So once we ask these questions, if somebody presents as food insecure, what happens? Next slide, please. So in the community health center setting, patients who screen positive receive counseling from the provider. So during the provider visit, information pops up to indicate to the provider that the patient has screened positive for food insecurity. The provider is trained to ask some questions as to whether the patient is enrolled in public benefits programs such as SNAP or WIC if there is a pregnant woman or a child under the age of 5 in the household, whether they are working or clients of any local emergency food sites such as a food pantry or a soup kitchen. And then they're also advised that they will be receiving information as part of their departure summary document that has hotlines as well as information about connecting with one of our social workers to either apply for the program or get connected with the local food pantry. And last but not least, during that, at the end of the visit, the patient also receives a voucher to obtain fresh produce through a partnership that we have with the Greater Chicago Food Depository, again, our region's food bank, to obtain fresh produce at a visit that a mobile produce vehicle makes to that health center every other month. Other interventions, in addition to the Fresh Truck partnership that we have undertaken with the Food Depository to address food insecurity among our patients and among Cook County residents in general, is we have been a host of the Summer Meals program for the last 3 summers, and we are underway to try to figure out how we can host this program again this summer, even in light of all of the challenges with COVID. For those of you who may not be as familiar with Summer Meals is the program that provides meals to children who would otherwise be getting either a free or reduced price breakfast or lunch at their school. So this is really a substitute program for those out-of-school days in any normal period when children are normally out of school just for the summer, that offers no-cost healthy meals because they're not in school and not getting those meals at school. So we've had 3 of our health centers host these meals for children 18 and younger. They do not have to be a patient of our health center. They really are open to the community. And we've had a really tremendous just connections with the community as a result, and our staff have really enjoyed hosting that program as well. We've also piloted fresh markets, which are a model of essentially having a farmer's market on site at several of our health centers. This is a slightly different model than our fresh market and our other programs that are offered at no cost. Different than our Fresh Truck partnership. The fresh markets are a purchase program, but it's in partnership with a local nonprofit that actually provides and sells the produce, and SNAP is an accepted form of payment, as is cash or credit or debit. And it's really just another venue for not only our patients, but also our staff and the general community to have access to healthy food options that they can purchase in their community. We've also piloted a program called Cooking Matters, which is run through the No Kid Hungry campaign, which is a 6-week nutrition education and culinary education program that provides families and individuals who have limited resources with the skills and kind of confidence to purchase and prepare healthy meals while on a budget. And we have also, we have another pilot underway with the Food Depository that provides home-delivered prepared meals that are prepared by the food depository through a job training program that they run there that we are piloting to kind of see the efficacy of pairing the prepared meals program with some health coaching from our community health workers and care coordinators of whether we can move the needle on some health metrics. And last but not least, in partnership with our health department, we have been participating in the Good Food Purchasing Program, which is really looking at the purchasing power that both Cook County Health and also more broadly Cook County government has in potentially changing how we purchase food and how we can source food that is locally produced so that we can be contributors to the local economy and the local food producers, whether they are growers or other types of producers, and also support more sustainable ways that are environmentally friendly, that treat workers in a fair way with fair wages, and that offer more humane practices. So that is underway as well, and I think that with COVID and all of the supply chain questions that have come up, there will be even kind of stronger interest to see how we might be able to, once we get past some of the challenges that we're in right now, to see how we might be able to focus some greater efforts on that. Next slide, please. So this slide and the next slide are just illustrations as to what this Fresh Truck program looks like. And this is one of those programs that I'm really proud to say that in partnership and collaboration with the Greater Chicago Food Depository, we've been able to continue through the pandemic. This is the inside of that Fresh Truck. This is one of the things that we have had to modify. This is a choice model where prior to the pandemic, patients who were screening positive would present their voucher and they'd be essentially able to shop on the vehicle at no cost. But they'd be able to pick what type of produce they'd want. And typically at a distribution, patients would walk away with anywhere between 20 to 25 pounds of fresh produce that had been purchased just a few days prior to the distribution by the food depository. So it's not as if these were secondhand or leftover. They are fresh and purchased so that our patients are able to get, stuff that is just fresh and ready to eat and that tastes good. So next slide, please. So how have we pivoted? Next slide, please. We as a community have seen the COVID crisis really be overwhelming in a lot of ways. But at the same time, our partners like the Greater Chicago Food Depository, like food pantries such as the Lakeview Pantry, which is a large food pantry on the north side of Chicago, have really pivoted their work and have gone into this hyper-response mode. So these are just two pictures that I really find very powerful in how these partners of ours have really risen to the occasion. And the picture on the left is of the United Center. So, and the picture on the right is actually the inside of Wrigley Field. So these two sporting facilities have been quickly converted into both storage and distribution sites that just, provide a snapshot into the tremendous need that we have seen from communities throughout the city of Chicago as well as throughout suburban Cook County. Again, many of the reasons that Deborah mentioned have driven this. Food insecurity existed before this, but because of all of the additional either restrictions or requirements or just guidance that people don't leave their houses unless absolutely necessary, have made it all that more challenging for individuals who were food insecure and are very resource limited, not only in their purchase of food, but possibly in mobility issues, in just access to transportation or a reliance on public transportation, or the fact that their children are no longer in school or they no longer have access to daycare. And the increase in need has never been greater. Next slide, please. So this is a picture of the one of the food depository fresh truck distributions that took place kind of just as the pandemic was underway, and in consultation with both our clinical staff and our infectious disease experts, as well as with leadership from the food depository, there was a tremendous, kind of interest and recognition that our patients are likely, again, experiencing the challenges of COVID more greatly than ever. And so the provision of food and continuing with that schedule continue to remain a high priority. But we needed to kind of change the process in which we were doing things in a way that could ensure both social distancing and the health and safety of staff and volunteers involved. Next slide, please. So we've modified our Fresh Truck protocols to basically take place entirely outdoors. So this is something where if there was inclement weather, we would move those distributions inside to our health center conference room. We've basically made the decision to expedite those distributions so they start as soon as the truck arrives, and that they will take place outdoors regardless of weather. And fortunately, as it has gotten a little bit warmer, we have avoided really, really cold weather and, for the most part, not gotten too wet through the various rainstorms that have passed through the Chicago area in the last few weeks. So we've been fortunate with that. We've also basically had kind of limited any contact between patients and staff. So instead of collecting vouchers, we've asked patients just to, show us their voucher and then move through the line. They keep the voucher, and then once we're ready at a future distribution to collect those vouchers, we will collect them at that time. Patients are no longer allowed on the Fresh Truck. Everything is carried off the truck and pre-packed in advance, so it's no longer a choice model, but we advise the patient that, this is what's in the box. If you need us to take anything out, a volunteer will take it out for you. And last but not least, we are doing temperature checks and screening all the volunteers and masking everybody. And this was prior to the health system having a universal masking policy, let alone the state the state of Illinois advising individuals to wear a mask in both indoor settings as well as in outdoor settings when social distancing is not possible. So we took all those precautions and put them into place as new protocols, and we have had all of our Fresh Truck distributions since the start of the pandemic run relatively smoothly, and we have continue to provide food. In fact, to date, we have, in total, since the beginning of the Fresh Truck distributions at the end of 2015, we've provided over 685,000 pounds of fresh produce to individuals at our health centers and throughout the county. So we're really proud of this work and grateful to the food depositories for continuing in this work with us. For our patients and health plan members, we also realize that making sure they have the most current information about public benefits as well as other resources that may be available to them is also critically important. Those food distributions, while they may provide some relief for maybe a week at a time, they're only hosted every other month. And so we want to make sure that those patients and health plan members are connected with their community-based resources that may have greater availability to provide weekly distributions, and in some cases, some of those food pantries have started to provide home deliveries to individuals who are not advised to leave the home or can't leave their home. In addition, as Deborah mentioned, there have been policy changes that states have decided to apply for or adopt when it comes to the SNAP program to make it easier to either enroll on the initial basis or to stay enrolled, including easing interview requirements as well as just expediting the review process, as well as easing work requirements. And many states had work requirements in place. Illinois was one of them that was transitioning to work requirements. There is a waiver in place in Illinois, or there is a kind of a lift on the work requirement piece while the pandemic is taking place. So that's one less thing for individuals to have to worry about. Of course, we know that also many people are new to the SNAP program because they are newly either unemployed or newly underemployed. So as we are screening patients for Medicaid, and many who are new to Medicaid, we are also screening them for SNAP, and when it makes sense, referring them to organizations like the Food Depository or other community partners to help them with that SNAP application. We've also been advising families about what's referred to as pandemic EBT or PEBT, which is a special benefit that is provided during the public health crisis that provides families with children additional SNAP benefits that essentially make up for the meals that those children would have otherwise had in school settings, so those free or reduced meal programs. In Illinois, this is a benefit that's automatically added to household SNAP benefits, and for families that are not enrolled in SNAP, they do have to go through an application process. But just knowing that this is available means that families can have access to additional funds on their monthly SNAP allotments to help them, purchase the food for the children in their household. Advising about meal pickups at schools for children, making sure that our care coordinators, our social workers, everybody is well-versed as to where patients and members can be pointed about these resources. On our health plan side, our health plan has also recognized this need among their members and has stood up a new benefit that just started about 2 weeks ago, which is providing for prepared meals to be home delivered for individuals who can't go out on their own or aren't recommended to go out either because of a positive COVID diagnosis or because they have some other condition that prevents them from safely leaving their home, and providing that as a managed care benefit for members of county care. The state of Illinois Medicaid agency has also applied for a provision as part of our 1115 Medicaid waiver to actually allow for Medicaid managed care plans to cover home delivered meals, but that waiver application is currently pending. And then last but not least is continuing to think creatively with our partners at the Food Depository, who really are the leaders and the experts when it comes to the distribution of food and being nimble and responsive to community needs. After talking with our own staff, with our care coordinators who have historically, or who have, as part of their normal work, have done a lot of home visits to meet people where they're at or accompany them to doctor's visits, much of their work has transitioned to telephonic outreach, but in some cases, when our care coordinators need to visit a member's home, they still do so. And some of our care coordinators have mentioned that they'll go to somebody's house to deliver medication or to do a wellness check, and the person basically says that they have no food in the house. So we work with the Food Depository to get several dozen boxes of shelf-stable food, similar to the boxes that you saw in the picture earlier that were shown being stored at the United Center, to basically just have available for care coordinators to have in their trunks. And if they are encountering a patient or a member who is basically expressing a need for food that needs to be met immediately, that we have the ability to basically just hand out one of those boxes to those families. So those are all examples of ways that we have tried to do our best to both listen and respond to the needs of our patients and residents of Cook County. Next slide, please. So as all of you are thinking about, hopefully thinking about ways that during the COVID crisis, as well as after all of this settles down a bit, ways to implement some work around addressing food insecurity, high on my list is making sure that your staff and, as a result, your patients are informed about opportunities to enroll in SNAP, which is a program that, again, has eased some of the requirements in both applying for benefits as well as continuing benefits, and just making sure that individuals are notified of, the fact that this program exists and the process to apply for benefits. Establishing or strengthening partnerships with the regional food bank has been so critical to us pivoting in this work. And I cannot say enough good things about the Greater Chicago Food Depository and both their commitment and leadership in just continuing their relationship with us, and even thinking creatively as to how they can further support us and our patients during this time. Volunteering or providing financial support to food banks or local food pantries is something that is on our list. We have sent teams of our leadership in the past to just not only tour but also volunteer at the food bank so that they can understand, what it is they do and get to see the size and scale of their operation, as well as sending our folks to kind of the food pantries that are in close proximity to our hospital so that they can understand how that distribution process works as well. Hospitals and healthcare providers can serve as a very influential voice when it comes to advocacy for improved access to food and nutrition benefit programs at both the state and the federal level. In talking with our hunger advocates in Illinois, our anti-hunger advocates, I should say, there is talk about some changes to SNAP in the next federal CARES Act bill that would increase the minimum SNAP benefit so that the floor would be raised a little bit higher for those who are on the higher end of the SNAP eligibility level, but still providing them with some additional benefits, as well as again, easing some restrictions that exist in the SNAP program. So hospitals, and like I said, can be a very strong partner and strong voice in this because we understand the downstream effects of not having access to not only food, but also healthy food. Listening and responding to the needs of patients and meeting them where they're at, and then ensuring that staff have the most current resources so that they can then cascade that information down to their patients and the community in general. Next slide. And so I like to end these presentations just with the fact that food is really this common thing that, unfortunately, while we can't be together in person, I think is really this universal issue that all of us can understand. All of us can understand this issue of hunger because, you can go, you can be lost in your work and understand, the physiological response that your body has. And so while we may be fortunate enough to have resources so that we ourselves are not experiencing food insecurity, because food is one of these universal things that we all need to survive and thrive and that can bring us together. It really is one of these things that I think is a fundamental piece and an important social need that essential hospitals can have a really strong and important role in. And I hope that you get at least one idea from this presentation that you can take away with you to implement in your own community. And so with that, I'll turn it back to Deborah and Vanessa.
Thank you, Kathy. Now it is time for the Q&A portion of today's webinar. If you have a question, please use the raise your hand function to let me know to unmute your line and announce you. As I mentioned at the start of the call, you also may use the chat function to ask a question. We'd also like to hear about your experience with food insecurity during this pandemic. We do have one question here already for us. This question is for Kathy. Kathy, where are hospitals finding the funding to address increased food insecurity needs?
So this is a great question. I can speak from our own experience in that I think we were fortunate enough to have had this relationship with the food depository prior to COVID happening, which is, why I would strongly stress to other hospital partners that if you don't already have a relationship, please build that relationship. And you don't have to wait. You can start now. We as a system don't have dedicated funding, but we have somebody who is kind of the point person on managing these relationships, and that's me. So in terms of funding, it's really right now staff and kind of having staff who are not only dedicated to serving as either a liaison or a point of contact, but then who's also coordinating some of the internal functions. So I'm also the point person for our internal coordination of all of our different community health center sites in making sure that they are screening for food insecurity, that any issues regarding a distribution or any issues around a change in operations get communicated through me, and I can get it to the food depository so we don't have 15 different sites throwing questions at the food depository without a uniform approach. So I can say that locally that other hospitals that have been looking at how to either increase or pivot their response have also looked to their own hospital foundations. to see how they might be able to either support, for example, a pantry that might be serving the patients within the hospital community. There are locally in Chicago and Illinois, there are also a large number of foundations, both philanthropic as well as kind of, in some ways, government-supported efforts that have pooled resources to address immediate needs, including food. And while we ourselves as a system did not apply for those funds, many healthcare partners did. And so I would imagine that if those resources exist in other communities, that hospitals, it might be worth, that might be an opportunity to work with and collaborate with other partners that are doing the food, and because hospitals know how to identify these patients, to either serve as a distribution site or to potentially use those funding opportunities as a way to catalyze a relationship.
Thank you, Kathy. We have another question here submitted through chat. This question is, what changes have you made to the food insecurity screening processes since COVID-19 erupted?
So at the health system, we have continued to screen patients for food insecurity. We have not stopped. The two-question screen is a relatively quick and easy screen for our staff who conduct the intake process to screen for. At the same time, I think we have communicated to our providers that there is a recognition that our patients are likely experiencing food insecurity at higher rates, even if they're not screening positive. So to kind of take an approach of making sure that they themselves and their teams are well informed about all of the changes, either to SNAP or the community resources that are out there, to make sure that they are informed so that they can address and provide resources in a way that doesn't require a positive response to a food insecurity screening, but that they have a heightened way of, kind of sharing resources. I'll say, too, that in our community health centers, because we have transitioned mostly to telehealth for those patients that it's appropriate for, we've also been, as we've reached out to those patients via telephone or video chat, we've been asking, whether it's okay for us to text you information. And for those patients that have agreed to receive text messages from us, we've been sharing information about these resources, including, if you're having trouble getting food, here is a website or a phone number that you can call, which is basically the food depository, that can provide you with additional information as to where you can get connected with food. We've also done the same with mental health resources as well as other needs. And so that's been a new form of communication that we have pushed out just without needing patients to be flagged for the issue of food insecurity.
Great. Thank you, Kathy. I just want to send a reminder for our attendees. If you'd like to ask a question aloud or to share your insight from your own hospital's experience confronting food insecurity during the pandemic, please raise your hand and I will unmute your line. We do have another question here for you, Kathy. This question is, has there been any reciprocal support from your food partners, for example, to help link community members to healthcare or supply food for healthcare staff?
That's a great question. I will say that when it comes to the food depository, we have always kind of encouraged them to share information if they encounter individuals who are calling for SNAP enrollment, who are looking for a healthcare provider, to say that we're happy to, we're accepting new patients, and to be able to have that reciprocal relationship that way. So I don't have any counts as to how frequent or how many new patients we've gotten through that, but that has been a longstanding part of the relationship that we've had with the food depository. The same thing with some of the food pantries that actually do the distribution that are in the general areas of where we have facilities. We've encouraged staff to not only visit those sites, but also volunteer on their own time and just to see what those operations look like so that we can help build stronger referral relationships, not only us referring our patients to those pantries for food, but then also, same thing. If those pantry clients are looking for healthcare resources, they can send them our way. And in some instances, we will send our community outreach staff to staff some of those pantry distributions and just share information about either our financial counseling programs, county care, our Medicaid health programs, or, just the fact that we have a clinic 2 blocks away that if people didn't know about it before, hopefully they walk away with the knowing that we're an available resource for them as well.
Thank you, Kathy. We have another question here. This question is, do you have any advice for a hospital that doesn't have a food insecurity program in place and wants to get one up and running now?
Yes, I would say find a champion of sorts, both on the operational side and ideally on the clinical side, so that you can have buy-in from different parts of leadership. I myself am not, I'm in policy and government affairs, so I will say that part of the way that I found myself into this role was that I expressed interest and was really excited about this opportunity to partner with a really well-trusted resource in the community in the food depository. And, I've been the point person since those conversations started. But there might be other folks within your institution who, it makes, if there is somebody who's overseeing social determinants or population health, you might want to start there. But also a clinician who, understands the need and can be an advocate on the side of either physicians or other staff members who are interacting with patients on a regular basis and can kind of serve on a voice on the clinical side as well. That was really important to us in getting buy-in from our staff, especially with the screening. As I think all of us have a lot of screening fatigue with the many screenings that we are required to, but also want to have in place so that we can best connect our patients with appropriate resources and programs and services. And when the idea of, yet another screening was brought up, it was really important to have that physician champion who, said, yes, it's another screening, but it's 2 questions. We're going to pilot it. We're going to work out some of the kinks and figure out who the right person is to ask these questions, and then we want to make it easy for staff. So I think having those champions and then having also buy-in is an important thing. We started off by implementing the screening question in one clinic and then grew it and until we had all of our clinics adopt it. But it wasn't something that we said, everybody must do it this way. It was, this is new to us, so let's take our time and figure out what works and what doesn't. And that way we can have clinics and health centers that implemented this first kind of be advocates and spokespeople for why this is a good program. The other part of this is obviously having a strong partner in the either a food bank or a food pantry that can either be a point of a referral, a place to refer, or just a partner in this work. We don't pretend to be experts in the anti-hunger space. We rely on our anti-hunger partners to be the experts, and we try to play the most appropriate role when it comes to lending our voice as a healthcare provider to these conversations. That, at this point, we rely on them. They're the distribution logistics experts when it comes to the provision and purchase of food and how to make this work logistically. So it's been a really nice relationship that we've been able to develop. And I would say in your own community, find out who those champions are.
Great. Thank you, Kathy. It looks like we have one last question for today, And this question is, what concerns do you have about long-term food insecurity issues as the pandemic continues?
So one of my big concerns is that, as I mentioned, with the SNAP program, many of the changes and easing of the requirements for SNAP really are in place only through the public health emergency. And I think because SNAP is a program that is meant to be a supplemental program to support individuals who have a hard time affording food through other means, that those challenges will continue. I mean, this is something that if the unemployment projections are as serious and as dire as they are expected to be, even after we get back to some semblance of getting the economy turned back on, I think it'll be a while before we see a full economic recovery, which means that we will still have a lot of people who will have need for programs like SNAP, certainly Medicaid, and that the easing of these requirements only during the public health emergency is probably not going to be sufficient. If we're putting into place work requirements when there is no work to be had, and if you can't meet those work requirements, that means you no longer get SNAP. Well, you know, that is not only bad for that individual's household, but it certainly has a negative consequence on that person's health that we as essential providers and essential hospitals are going to see down the road. So that's a concern for me, but I do think that, again, in partnership with our anti-hunger advocates, our food banks, they are on the forefront of advocating for, policies both at the state and federal level, and, us lending that Help Your Voice that can help make those voices stronger and those coalitions stronger. So, while that is a worry of mine, I do have hope, because I do think that there's a lot of really great organizations that are working on this and that have already, started thinking about this and laying the groundwork as to how we not only get through the immediate need, but also look at the long-term needs and how do we make some structural changes to improve the SNAP program and access to food generally.
And this is Deborah. I'll just jump in for a second and build on what Kathy just said. I agree. I mean, there certainly are some long-term concerns for how the pandemic and the related economic downturn continue, but I agree with Kathy that there is a lot of opportunity, and both in sort of the recognition of the severity of food insecurity as a need in multiple communities, but also the need for flexibility. I mean, I was talking with someone who runs a food pantry in another hospital, and she was talking about all of the ways that they've been working with the food pantry with which they partner to relax some of the existing rules, offering a 7-day supply of food instead of a 2-day supply of food. Obviously, that requires resources. That there is an opportunity here because the situation is so dire that it's sort of a prime opportunity to begin these relationships where they don't already exist and to relax some of the some of the rules that are in place where those relationships do exist. It's somewhat of a parallel to what we're seeing on sort of the telehealth side. There were a lot of restrictions in place that prevented hospitals from providing those services before, and now the circumstances warrant some flexibility. I think the combination of the crisis and a willingness to be flexible, I think, will end up perhaps paving the way for longer-standing, more robust programs.
Great. Thank you, Deborah. So we are short on time, but we do have this one last question that we'll squeeze in here for you, Kathy. Are you screening inpatients as well? If so, when are you screening and who is doing the screening?
So we have struggled with this a little bit. We are screening inpatients, but it's just not as consistent as with our outpatients, just because of the structure that we have with the social workers and also the individuals who are staffed in the inpatient units. And the question really has to do with, you know, when they're going to be discharged and what resources they might be able to be provided at discharge. So we're trying to do a better job at this. So I can't say it's a universal screening that we're applying for inpatients, but it is a question that I have been pushing with our social work and care coordinator team that at the point of discharge, we should be screening patients. And if it turns out that they are screening positive for food insecurity, we might want to think about a different set of resources to provide for those patients. During COVID, one of the things that we are doing with partnership with the food depository is providing patients being discharged from the hospital who don't have other resources with that shelf-stable box of food to at least get them through to, you know, a period of time until they might be well enough or until we can get them connected with another service. And also trying to figure out if we can get them into if they're a county care member, also get them connected with that prepared meals program. But I will admit that it's a little bit of a harder lift because they might have a different set of needs when they leave that hospital and also with the timing of discharge.
Great. Thank you, Kathy. And thank you, Deborah. And with that, we conclude today's webinar. Just a reminder that we have a new COVID-19 email list for members, so please visit the COVID-19 resource page of our site to sign up. It's a great way to continue the conversation and ask additional questions related to this webinar. Here is contact information for today's presenters in case we couldn't get to your question today. Also, please keep an eye out for an email from us tomorrow that will contain a link to a brief evaluation form. Please share your thoughts, which can help us to ensure our webinars best meet your needs. The email also will contain a link to a page with a recording of and materials from today's webcast. Join us again next week at 2 p.m. Eastern Time for another great webinar on behavioral and mental health needs. To learn more about this webinar, visit the Education tab on our website, essentialhospitals.org. Thank you again to our speakers and to our audience. Enjoy the rest of your day. Goodbye.